Eating to protect your eyes. That's what we're talking about this morning with ophthalmologist Dr. Robert Abel. And he's here to talk about some things that we can eat, as well as some misconceptions about, I think, a lot of us assume that eye health, it's genetic. There's nothing you can do about it. But you're saying quite the opposite, in fact. So first of all, let's talk about some clues that folks should be looking for. You say we should become better medical detectives.
Yes, we need to take charge of our own lives. There's so many clues. The best benchmark is glare. How quickly people recover from glare. The eye is like a biochemical workshop. It's two lenses, a bag of water, focusing light on the retina.
Okay.
All of the nutrition for the retina is in the liver. So what you eat is what you see.
Wow.
And there's certainly not a lot of trans fats or any artificial sweeteners there.
Yes, absolutely.
Because those things make dry eyes worse and make glaucoma worse.
So it can even be something you see symptomatically.
Exactly.
Wow. Okay, so let's talk about some of those foods. I think in general they're healthy foods that will help our eye health as well.
Exactly. They're the same healthy foods for your brain and the rest of your body.
That's convenient.
40% of the brain is associated with what comes through the eye. So I know Fox had a report recently about mood and diet. Well, vision and diet is essential. People will know what they see from what they had the night before and how they will see things the next day. And the problem is, many people's diets are deficient. You asked about the foods: spinach, nuts, berries, eggs, organic meats, cold water fatty fish, filtered water, even a little wine and a little coffee, because coffee empties your liver. Okay. And nighttime, if you don't get enough sleep, you don't get enough nutrition to your eyes.
The role of sleep is certainly
Right.
playing a crucial role in so many health issues. What kind of successes have you seen in treating some eye disorders strictly through nutrition?
Well, let's say I've treated 6 times as many patients with cataracts with nutrition as with surgery.
Wow.
I mean, most things we have.
Say that again, because that really is a stunning fact.
We have an epidemic of cataracts with the ozone layer and sunlight. Sunlight is a major cause. Wear sunglasses. But there are at least 6 times as many people can be improved nutritionally. Almost any disease you have, you can still have the complementary option. Ophthalmologists are smart, good, well-trained people, but very few are hybrids into the nutrition field.
I was going to ask you that very question, that it doesn't seem as though too many ophthalmologists are talking about the nutrition element. Let's go ahead and mention your book, if you would, and also you're holding a multivitamin, which I think we should probably discuss as well.
Well, I've been so deeply entrenched in the nutritional aspect, besides previously being a clinical professor and doing all the academic things. But I feel strongly people need simple things. They take vitamins for their bones, for their heart. They really need it for the eyes, and it's good for everything else. So we created, my partner Randy Bellows and I, created a vitamin with 23 essential nutrients that's good for eyes. You will see a recovery from glare, and it comes with a pamphlet with 3 eye tests that you can actually compare a month later. Did I improve or not?
So you can quantify your results. I want to make sure we
Exactly.
mention, we will put the information for Dr. Abel's book as well as the multivitamin, some great info, and a lot of it, there's optimism out there for folks. We'll post all of that information on our website at foxbaltimore.com/morning. Thanks so much for being here with us this morning. Some
Thank you,
really
Mary.
good stuff.